I had to look at this case several times just to verify what I was seeing and that the patient was biting the same way. Nothing dramatic, but really interesting. So basically, on the left is how the patient started. So this is what's called, dentists who watch my channel will know this, a class 1 occlusion. Every upper tooth is sitting characteristically kind of like a half step behind the lower. The teeth interlock. And then on this side, you see the same thing. Is maybe you see this canine here is a little bit forward. It's supposed to sit in here. So maybe it's a slight class 2 on that side. But the midlines are on, and we have overjet and an anterior open bite. But the overjet is one I want to focus on. You see we have about a 3 to 4 millimeter overjet. Now, the treatment was designed to broaden the upper arch form, which always will flatten the arch form. Anytime you have an arc, if you broaden it, it flattens it. Now, there's no interproximal reduction planned in this case. I thought I would reduce the overjet modestly and then maybe consider doing some interproximal reduction. But this is actually where the patient is right now at the end of these 27 aligners. I thought when I saw this, the patient may not be biting properly and that maybe their mandible was forward. But if the teeth here are in the same bite as they were to start, and the same issue right over here, same relationship, and we just have this greatly reduced overjet simply from changing the arch form. Again, I had to verify that I didn't do any filing on these teeth, but there was no interproximal reduction planned in this case. So you can see the arch length is reduced. And I use this to great effect in many cases of people who have quote unquote overbites, where broadening without extracting and even with minimal to no IPR can help reduce an overjet.